The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to the Association of Schools and Programs of Public Health, ASPPH Presents webinar series. This one on global health competencies for the MPH degree and accompanying toolkit. Since we have many participants on from all over the world, we have muted your lines to reduce distractions. Your method for submitting questions is up here on the screen. At any time, if you have a question, comment, idea now, at any time during the webinar, we are really eager to hear from you. Go ahead and type it into the chat box and we'll be able to see them as they come in. I'm going to walk through all 5 presenters, introducing them and go over the learning objectives, and then kick off the flow for the presenters. I'm really pleased that our first presenter today is Dr. Jim Curran, Dean of the Emory University Rollins School of Public Health in Atlanta, Georgia. And Dean Curran is also chair of ASPPH's Global Health Committee and thereby serving on our board of directors. Our second presenter is Dr. Laura Magana, the president and CEO of the Association of Schools and Programs of Public Health. Our next presenter, in providing the bulk of our presentation today, is Dr. Elizabeth Abla, Associate Professor at the University of Kansas School of Medicine in the KU MPH program. And Dr. Abla was also key consultant to the ASPPH Global Health Competency Development Project, both of them. The initial one back in 2009 through 2011, and the one that we're wrapping up here and presenting today that wrapped up in 2018. Next, we have 2 reactors joining, wearing the hats of their unique associations. I'm delighted to introduce Dr. Peggy Bentley of the Consortium of Universities for Global Health, or CUGH, where she is their Secretary-Treasurer. Dr. Bentley also is the Carla Smith Chambly Distinguished Professor of Global Nutrition and Associate Dean of Global Health at the University of North Carolina Gilling School of Global Health in Chapel Hill, North Carolina. And our last reactor today is Dr. Kasia Chabanowska. She is president of the Association of Schools of Public Health in the European region, or ASPPHR. And as well, she is the associate professor at the Department of International Health at Maastricht University, the Faculty of Health, Medicine, and Life Sciences. So welcome today and thank you. I'll be serving as your moderator. I'm Liz Weiss, Director of Education at the Association of Schools and Programs of Public Health. And we have 3 learning objectives for today that we hope to achieve by the end of this 1-hour time with us. We hope that you're able to identify the 6 competencies that ASPPH developed as a resource for CEF accredited institutions offering MPH global health concentrations. Secondly, that you could describe the main features of the accompanying competency toolkit. And in addition, that you can reflect a little bit on the methods you might use to apply these competencies into your own curricular and practice offerings. So with that, I turn the floor over to Dean Curran. Jim, the floor is yours.
Thanks so much, Liz. Liz mentioned that I was chair of the Global Health Committee for ASPPH. That committee undertook a 2-year evidence-based research and consensus process to produce the Global Health Concentration Competencies for the Master of Public Health degree. These competency set was released in July of this year, and it is specific to MPH students only concentrating in global health. It does replace the ASPPH 2011 competency model, which many people were also engaged in, and it was broad and applied to all master's level students at the time, including schools and programs outside of accredited public health. In this webinar, we are going to release a new toolkit that accompanies the competency set. So I'd like to thank all of the hundreds of members and global partners who participated in the competency review process, development, and vetting, and in particular to the chairs of the committee, Dr. Peggy Bentley, who you'll hear from later, and Dean John Finnegan from University of Minnesota. Much of the work has been done by our 2 Elizabeths, Dr. Liz Abla, that you'll hear of, the main consultant, and Liz Weiss, the staff member at the ASPPH committee. So it's my pleasure now to introduce to you our president, Laura Magana.
Thank you, Dean Curran. I'm very, very excited to participate in this launching of the toolkit that accompanies the global health competencies. So I'm just very briefly going to be talking about the approach, the audience, and the connection to SIF criteria in these competencies. So this is the one that I have in this slide I have right now in front of you. It just reminds us that right now we are in the competency-based education model. Remember that before we used to just come up with a curriculum, and then we came up with educational objectives, and then hopefully we did some assessments from those educational objectives. But right now, since the health professions for New Century report, we were reminded that we really need to start with the health needs and the health systems, and to assess those in order to come up or identify the competencies or the outcomes that were needed from our graduates. And with that, then we can go ahead and develop the curriculum and the assessment tools. So that was exactly the road that we took. We took this assessment first of the needs in order to identify the competencies. So as Dean Curran commented, the target audience for our global health competencies are the MPH students concentrated in global health upon graduation from a CIF-accredited school or program. So Elizabeth Abla is going to go right now to actually talk about all the 6 competencies, but I just want to let you know that these competencies that you are looking right now in orange are built upon CIF's 2016 foundational requirements for the MPH. So we really need to start at the bottom, as you can see here in this slide, where you see CIF's D1 requirements, which are the 12 foundational knowledge objectives. So for example, you will find in that category competencies like explain how globalization affects global burdens of disease. So we already have there some global health perspectives that all MPH students, they need to accomplish. The next level in CIF criteria are 22 foundational competencies, which are the purple one. And for example, just to mention one that they have identified there, says assess population needs, assets and capacities that affect communities' health. So it's, again, there are some already global health competencies in these foundational categories. So beyond that, at the top and in orange, you find the ASPPH recommendations for the global health MPH concentration. So ASPPH work is particularly important because for the first time, CIF-accredited institutions that offer global health programs for their MPH degrees now have a national benchmark against which they could check their competency-based offerings as aligned with their own mission and objectives. I would like to stress that ASPPH offers these concentration competencies beyond the foundational competencies as a guide. It's a voluntary use, certainly for our members, but beyond our members, just for your consideration, adoption, and of course, adaptation. So in addition, the toolkit that Dr. Abla is going to present and to walk us through shortly offers illustrative learning objectives for each competency, along with a method for framing central curriculum content and listing of exemplar resources. So with this, I just wish you well in using these competencies to help meet your own degree objectives. So Elizabeth, can you walk us through the competencies and the toolkit, please?
Absolutely. Thank you so much for the opportunity to be a part of this webinar, Dr. Magana. I'm really pleased to share the toolkit that ASPPH has developed to assist global health instructors in designing competency-based global health curricula. So I'm really excited to be here today. Thank you. ASPPH underwent a 2-year process for this project, and it was implemented in 2 phases. The first phase was to review the 2011 Global Health Competency Model version 1.1 with members and also other global health partners. That started in August of 2016, and we surveyed and interviewed global health experts as a part of that process. Specifically, phase 1 assessed the use of ASPPH Global Health Competency Model version 1.1. As you know, that 2011 model is now obsolete. So phase 2 represented a process to modify and update the competencies. In the second phase, we examined additional global health competencies and vetted draft competencies with global health experts. Here you can see our model document and the associated URL to access the document. It is also under the Handouts tab on your screen on the right. Thank you to so many of you. You took the time to respond to the survey and participate in phone interviews. We had 88% of ASPPH's members participate in this process, along with CUGH members and other academic partners whom we identified as teaching global health. Additionally, thank you to the scores of you who vetted our draft competencies earlier this year, both in person at the ASPPH and CUGH annual meetings and online as well. So I'm going to present to you the 6 ASPPH recommended global health concentration competencies for the MPH. And again, as Dr. Magana mentioned, these are recommended. These are for voluntary use. So I'm going to briefly talk through each one of them. The first is to analyze the roles, relationships, and resources of the entities influencing global health. The second, to apply ethical approaches in global health research and practice. The third is apply monitoring and evaluation techniques to global health programs, policies, and outcomes. Propose sustainable and evidence-based multi-sectoral interventions considering the social determinants of health specific to the local area. Design sustainable workforce development strategies for resource-limited settings. And finally, display critical self-reflection, cultural humility, and ongoing learning in public health. Now, 2 points I'd like to make here that are of interest. First, the bold and italicized words are from Bloom's taxonomy. These are the verbs that are designed to help the instructor determine the appropriate level of content for the student. Second, the Bloom's taxonomy, which I'll show in just a moment, offers 3 domains generally. Those 3 domains are cognitive, affective, and psychomotor. The competencies here, 1 through 5, are in the cognitive domain, whereas the 6th competency here is within the affective domain, the affective domain. And affective is the manner in which we deal with things emotionally. So they tend to be feelings or potentially even values, which is the case here. There are 3 tenets that upon which these concentration competencies are built. The first is to inform curricular planning for CEIF-accredited schools and programs by offering examples to fulfill CEIF's requirements for the at least 5 distinct competencies for each concentration. So obviously, our 6 address that. The second, it's designed to serve as a roadmap to improve education for global health. And then finally, it's designed to prepare students upon MPH degree completion with a specialization in global health for a trajectory to assume roles across local, national, regional, and transnational settings. So here we have a comparison of the 2 models. The old model, released in 2011 that we've mentioned several times, the target audience for that group was for master's level students specializing in global health. Whereas you can see here with the new model, we are focusing on master public health students that are who are specializing in global health. The competency structure for the old model was 7 domains and 38 competencies, whereas the new model has 6 concentration competencies. The very clearest, most distinct change is that the old model had the 2009 ASPPH produced MPH competencies as its foundation, whereas the new model has the 2016 CEEF-produced accreditation criteria for its foundation. And we're very excited. The old model, we did not have supporting materials to assist faculty, and we are very excited to be able to share with you a toolkit that will serve, I think, to advance the new model, and we'll actually, let's dig into it. So the toolkit is the best way that faculty can use these competencies. The toolkit provides definitions. It starts out with definitions for competency model, for domain, for competencies, etc. We provide background on competencies generally and competencies in global health, developing learning objectives from these competencies, and developing coursework from learning objectives, and how we also provide some sample curricula content. We have a listing of exemplar resources and also an appendix, which I will describe here in just a bit. So let's get into it. The first, we provide some definitions. So we want to make sure that it's very clear what a competency is, and a competency has three components to it. One, it's an action verb that is measurable. There is content, and then context when necessary. So let's do an example based on what we know from our competencies. This is actually competency number 5, design sustainable workforce development strategies for resource-limited settings. Very clearly, design is the action verb, the content is the sustainable workforce development strategy, and then the context is the resource-limited settings. You'll see here, this is the Bloom's taxonomy that I referenced a bit ago. So there are 2 domains that are addressed in this competency model, cognitive and affective. You can see the cognitive domain here. If you were to click on the URL that is at the bottom, you can access this resource, and you can also scroll down and you will see a very similar looking table that is the affective domain. And so you see here, cognitive domain level 1 starts at remember, all the way up to level 6, which is create. Whereas with the affective domain, level 1 is receive, or be open to willing to hear something. Whereas the 5th, which is the highest for affective, is characterized by value. So we see display here, also advocate, defend, incorporate. A fantastic resource here for you. So once you have a competency, you can then develop sub-competencies and learning objectives. So a sub-competency is the required behavior that must precede a given competency and or combine with other behaviors to demonstrate a competency. A learning objective specifies the aim of a lesson, course, or curriculum and reveals the knowledge and skills required to fulfill a given competency. So let's give an example. So we have the competency that we've already been dealing with, the design sustainable workforce development strategies for resource-limited settings. We can propose and in fact we have proposed a potential sub-competency, synthesize the factors that healthcare workforce crisis contribute to the healthcare workforce crisis in resource-limited settings. Now we can further refine this down into potential learning objectives, such as this: present general trends and influences in the global availability and movement of healthcare workers. So we see here a citation, and there's also an asterisk. This suggests that the content has been modified from its original source. As we said before, ASPPH conducted a very robust review of the literature and other competency sets. And so you'll see that often throughout this resource, throughout the toolkit and also other resources that have been developed, there are these asterisks with the citations, so that if there was something that was taken from that but was not exactly verbatim, then we did indicate that through an asterisk. Some additional learning objectives that could come from this, for instance, analyze the gaps and related requirements for training public health professionals in resource-limited settings. propose the optimal economic, social, political, and academic conditions that can produce a strong health workforce, and construct strategies for establishing the permanency of healthcare workforce in Indigenous communities. So we're really trying to figure out, how do we operationalize some of this? So how do we get from the learning objectives and have those learning objectives inform coursework? So as you know, the learning objectives introduce students to objective and relevant resources to ensure students demonstrate that each component of the objective has been met, and then also to be able to measure it, to evaluate students using an objective and consistent structure. So what does this process look like to start with a competency and then break it down into bite-sized, more learning objectives? So you see here, we have a competency and a sub-competency that we've proposed in a learning objective that's been proposed. So all of these three verbs that are used here are using the same Bloom taxonomy level: analyze and examine. All of these are level 4 in the cognitive domain. The instructor needs to use the verb that is most appropriate for the desired learning outcome. So that may be at an equal level of the competency or a lower level to that competency verb. But a learning objective cannot exceed the level. For instance, since all three of these are level 4, analyze and examine verbs are level 4, having a learning objective that would be at a level 5 would not be appropriate. Once the instructor has a competency and has the learning objectives, then the instructor is able to develop the instructional strategies. You'll see here in the yellow highlight that there are instructional strategies that have been included in the toolkit, but there are obviously many, many more. The intent of the toolkit is to provide some resources and get instructors thinking about what this can look like. So we have the instructional strategy. Then what's next? We would have the instructor consider how to assess the achievement of the learning objective. So again, yellow highlight corresponds we have this in our toolkit as an example. So let's take the first concentration competency that is a part of this model. We have that as analyze the roles, relationships, and resources of the entities influencing global health. How do we assess that? So assessment of that as we take that down to a learning objective that is consistent for that. And let's just say it might be conducted through a predefined rubric that the instructor would apply to the student's predefined deliverable. So let's say they are assigned to watching a video and reading a number of academic papers or participating in a round robin exercise, that students could then write a paper regarding these global health entities, such as the World Health Organization, the UN, CDC, UNICEF, World Bank, Global Fund, Gates Foundation. The paper would then outline each entity's primary function and funding sources, comparing, contrasting, and critiquing the global health entities. So this gives you an idea of how you would then start to make an accessible and tangible assessment tool. So the toolkit contains nearly 50 links and resources for the 6 concentration competencies. You obviously have your own favorites that you can draw from in your teaching. There are sample resources in this toolkit for each competency as well. And then finally, I referenced the appendix earlier. I want to provide just a little bit of context for this. So many of you were involved in the development of the 2011 and the current competency model. You know that there was considerable amount of work that was dedicated to developing these competency sets. So even though ASPPH's 2011 competency model is obsolete for CEF accredited entities, many of these competencies are still applicable for the field. Therefore, ASPPH mapped the 2011 competency model and other global health competencies to the CEF D1, Master Public Health Knowledge and Foundational Knowledge, and D2, Master Public Health Foundational Competencies. So you see here in number 3, you can see the two MPH foundational knowledge, the two items, the two competencies here: conduct formative research and conduct a situation analysis across a range of cultural, economic, and health contexts. Those are both under the third MPH foundational knowledge. The appendix can be really useful because the instructors would be able to figure out how to further enhance the foundational knowledge and competencies that are part of D1 and D2 with relevant global health content. So we're able to continue to use the work that has been invested in these global health competencies by continuing to expand the resources and the content that's available through the D1 and D2 MPH foundational knowledge and MPH foundational competencies through CEF.
Elizabeth, thank you. That was super. There are a couple questions in the box. We'll take one right now, and this person is wanting to go back to the assessment tool. That would be slide 30. And they're asking, can you recommend any options for assessment of competencies that cannot be used, that cannot be measured with traditional tests or papers? So looking beyond the one example provided in the toolkit. Elizabeth, are you on mute?
Yes, it really does help when you are not on mute. I'm just going to say that. Yes, so there are a number of ways, absolutely, to assess. And I think what is critical is that the assessment is in line with the learning objective to ensure that the student is meeting that, that learning objective that's been defined. The examples that could be provided, absolutely, we have a number of these here. You'll see reflection paper, for instance, that is something that can often be addressed through using the affective domain, where a pre-post doesn't make as much sense, but displaying critical self-reflection, cultural humility, and ongoing learning might be reflected there. Ongoing learning we often see, for instance, through journaling. That might be a way to have assessment tools that allow us to get at the learning objectives intent. Does that answer the question?
If I can add, Elizabeth, just for that question, which I think is a great question, I think it's important just to align every time your assessment tool with your competency. What you cannot do is just, if you have a high-level competency, for example, let's say discuss or apply, you don't want to use as an assessment just something that can be just recall or just write something from memory. You always have to align. So the further up you go in terms of the competencies in more higher order, the assessment should be aligned at the same level. So if you're saying like discuss and apply, analyze, at that same level, you have to choose your assessment, meaning they have to do something that can be applied, discussed, contrast. So always just make sure that the assessment tool will align to the level of your competency.
Great. Thanks to the both of you. We'll come back to other questions for Elizabeth at the end. And we're going to move on now to our reactors. We're really interested to hear what the Consortium of Universities for Global Health representative, Dr. Bentley, has to say. So, Peggy, the floor is yours.
Thank you. And thank you, Elizabeth, and also Liz and Jim and Laura. I'm going to start with my UNC hat on. My affiliation here, I've been very involved in changes in our curriculum here. And just as we were turning our attention to the CEF requirements, the 2016 requirements for competencies, we were designing a new curriculum for our MPH program. And we started in August, with an integrated core, meaning problem-based learning that would meet the competencies by having interdisciplinary team-taught core in the first year of the MPH program every morning from 9 to noon for one full year. This core is part of what our students are doing. So we were able to design our courses and competencies by aligning them with the ASPPH competencies, D1 and D2, for global health that you just heard about. We also are starting with new concentrations. We've never had a degree in global health, but global health will be one of our concentration areas. And among a total of 12 concentrations, which is really a lot. So we're going to see what happens with those. I'm really happy to say that we have more applications for the global health concentration than in any other at this point in time. But it was very important for us to be able to, at the same moment, the ASPPH competencies were being finalized, to be able to build those into what we're planning to do here. Another thing that we paid attention to, and I think I want to point everyone to, is the Global Health Fellows Program did a survey of employers for students seeking global health positions once they graduated. Let me tell you what some of the perceived weaknesses were as identified by the employers. And this is published in a publication in the literature by Sharon Rudy and colleagues. So the weaknesses identified, 43% of the respondents thought understanding context and realities of global health was lacking. 30% flexibility, adaptability, and creativity. 30% cultural sensitivity. 20% cultural communication, cross-cultural. 13% knowledge of key players, systems, and processes. And in addition, there were many skills, particularly monitoring evaluation skills, that I think they thought were very important. So that's where our future is for the training we're doing, and we need to understand from the employer's perspective, broadly defined, what it is that they need. So I'd like to also talk about now with my CUGH hat on, just as we were doing the new competencies that you just heard about, we were at CUGH developing a set of competencies for global health programs and degrees. And these are not just for schools of public health, but as you know, and some of you are on the webinar, we have many programs that are broader than just the MPH degree program. And there was a perceived need by CUGH that we really needed to develop competencies for them. So this was launched with their own toolkit in a webinar in October of 2018. And you can watch this and access their toolkit, our toolkit, by going to the CUGH website, www.cugh.org. I would just say there is substantial overlap between the ASPPH Global Health Competencies and the CUGH Global Health Competencies. And it's really worth taking a look for those of you who are at the stage of working on your concentrations or meeting these CEF requirements. So I think I'll stop here unless there are questions. Just to finish by saying what a pleasure it's been to work with the ASPPH team, with the Global Health Committee, especially Jim and John, and Elizabeth since 2016 on what we have envisioned for the future of global health training within schools of public health. Thank you.
Thank you. Thank you very much, Peggy. Terrific to get a 2-for-1 wearing both the CUGH and the UNC Gillings hats. We do have a 2-part question that came in from Costa Rica. I'm going to pass you the first one. You touched upon it, Peggy. It's specifically, have you thought of leveraging this resource with the CUGH Competency Toolkit? So if you might speak to how they may be leveraged.
Well, I think they really already are leveraged. I know we have some people in the webinar who are very much a part of the CUGH competencies. Elizabeth also mentioned that we cooperated and collaborated with CUGH when we did the survey and the interviews that Elizabeth mentioned to really understand from the perspective of people around the world what it is that they needed. We work really closely together with CUGH. I'm a really good transition person, so I feel that they really are leveraged. I think many of us go to the CUGH conference and belong to CUGH. You can join as an individual member if your institution does not belong, and that gives you access to all the resources that they have that you can access on the website, including this toolkit. I will just say that Jess Everett is my point person at CUGH from the Education Committee, so we can make those connections if you would like.
Thank you very much, Peggy. Yes, they very much speak to each other, and we at ASPPH carefully mined the CUGH model in our second iteration because it was in between our two efforts, and we wanted to add to the literature and not merely duplicate. All right, moving on to our final presenter today, another reactor. Kasia, the floor is yours. And you may be on mute. We're not hearing you quite yet.
Okay, now you hear me?
Yes.
Okay, so thank you very much for inviting me to comment on the Competent Global Health Concentration Competencies Toolkit, which I think is actually a great system. And I'm going to tell you why I think so. From two perspectives, again, as the president of ASPPH, so it is the Association of the Schools of Public Health in European region, and also as a director of the master program, Governance and Leadership. So maybe first I will say why I think this is a great tool and that can be widely used, and not only in America, but worldwide. So I think this is very comprehensive. First of all, the language that you use, it's clear, domains are very well defined, and actually it's hard to find professionals and educationalists who will disagree with the domains which you propose. It is fit for purpose, and I think that it really helps to build curricula, to assess the students, to accredit the programs, and it can be viewed from various perspectives. It is innovative. And I would like to state that it shows that public health goes beyond the silo perspective. So you manage to integrate the disciplines, and it reveals the interprofessional communication and participation of different professions, disciplines in this framework. So I think that it is a very strong asset of the work that you have done. It is operational and practical. It is action-oriented, as it was shown in the presentations, using the action verb. So actually, when you work with the framework, you can picture what you have to do and what you can obtain and what the performance should be. So I think that is really practical, and also it is manageable. Usually the competency frameworks used to be very long, and sometimes people got discouraged to use them. And this one is really practical and easy to use, I would say. On the other hand, it also shows a transition. I like the fact that you moved from the first module and now you show what has been changed, because actually competencies are not static. They change over time. So I think that this process that takes the framework, I say the system, to a higher level is also very interesting to follow. And what else? I would say that this framework is also very important from the point of view of global actors, accreditors, and organizations such as ASPPH and your organization, because it provides a platform for discussion with other global stakeholders. And it is also a very powerful quality assurance tool. Why? It can serve for just improvement and for accountability, for accreditation purposes, but at the same time, quality is, we can say that it doesn't mean anything if we don't think from whose perspective. And this tool allows for various perspectives. The course designers and people who develop the programs and curricula, as well as the students, graduates, employers, and those who deal with the accreditation. So it may also serve as an assessment tool for these purposes. And it encourages the collaboration of various stakeholders, and also encourages good practice exchange. And here I have to say that I'm also involved myself in the development of competency frameworks in Europe. And we have done an exercise with colleagues here in the States to find out how the tools that we develop compare. And there are a lot of dimensions and domains which really are similar. So what I would say is that we really have to work together to develop public health workforce for the future that shares certain characteristics and traits in the global public health. Because as you say at the beginning, I think, of the framework, that global public health is public health. Thank you very much.
Thank you, Kasia, very much. In addition to serving as president of ASPPH, I think I'm going to nominate you for president of the Competencies and Toolkit fan club. Those were those were very encouraging comments. We appreciate the time you've taken to review and to react to our model here. And I think we're going to move on to the open question period of the webinar. We have quite a bit of time, so go ahead. Questions, comments, we would love to hear them. Here is a question that has come in from an academic, and Elizabeth, this looks like it's for you. What are some sticking points, and any speaker not talking now, if you'd kindly mute your phone, I heard a little feedback. Elizabeth, for you, what are some sticking points in using a competency-based approach to teaching? How could you help this academic to start off on the right foot in using these competencies in the toolkit?
Yeah, it's a great question. Thank you. I think one of the things to consider with this is that the learning needs to be enabled in a manner that will yield observable and measurable results, so that the student is able to be competent in an area. So when we think about what some of Kasia's some of her comments, she talked about how there needs to be this consistency where everything aligns, and having the competencies and the learning objectives align with the assessment tools and the instructional strategies. It does take time to have this work, to undergo this work of developing sub-competencies and learning objectives from the competencies, but it is absolutely a best practice in education, and also in terms of allowing the students to be able to demonstrate the learning objectives that we set out for them.
Thank you, Elizabeth. Here's another one that I think is best passed to you. What tips would you have regarding measuring the competencies?
There are some of the, first of all, I'd say the toolkit. So when there's an assessment that is planned and developed to correspond with the learning objective, just again, make sure it aligns, that it aligns with the activities, and it aligns with the teaching and instructions and the strategies that are used for that, to ensure that indeed it is feasible for the student to demonstrate the learning and to be able to demonstrate that they are competent in that task. So yep, you could say even the first assessment is for the instructor, just to ensure that we are aligning the competencies, the learning objectives with the assessments and activities.
That's helpful. I'll take the next question. It is, have any schools or programs come up for accreditation for a global concentration? So I presume you're talking about the CEPH accreditation process. So CEPH just began this spring site visits for new candidate members and for reaccrediting members under their 2016 criteria, which we're still calling new criteria, even though it's been around 2 years, but people just a few months ago started, I think in April, getting site visited for the new criteria. And to be honest, I don't know how many have had a global health concentration that's come through the process. And I appreciate hearing any of you on the call, if you want to put in the chat box, hey, you know, I've come up and this is what CEF guided us. We'd love to hear it. That's an important point of learning for all of us. I have heard a major point of guidance for concentration competencies, I've heard this time and time again from CEPH, is demarcating the rigor that your concentration competencies are indeed distinct above and beyond those foundational knowledge and foundational competency areas. So the school or program needs to be very clear in showing how that concentration competency is above and beyond the already required foundational mandates from CPH. And speaking of CPH, I just want to go back to something, some of Kasha's points that, you know, ask for probably not many or any are come in for CEPH accreditation. And we're really hoping that even though our primary target audience are the CEPH accredited schools and it's built around that model, that, and I am encouraged by Kasha's comments that that other schools and programs could find value in the work here, the framework. You could take it, you know, these are competencies you adapt, you tweak, you put in a different verb. You don't like our verb, you want it higher or lower, you change the verb, you change the context, you change the content to make it fit what you want your students to accomplish in light of your educational mission, your educational objectives of your program or school. Okay, there's another question in the box. It's the second part one from our Costa Rica colleague, and I think, Dr. Magana, this might be good for you. It says, I am currently working with the Planetary Health Alliance to develop a competency framework. How do we find synergies with the ASPPH toolkit?
Well, definitely. Thank you for that question, because we are actually working with some global partners in trying to really share what we have learned and trying to just share all the framework, because regardless of the content of or the approach that everybody is taking, I think there's a lot to share in terms of the framework. So I'm happy to share everything that we have done so far with the ad group and others, and maybe just following up in also in the other question regardless with our relationship with CUGH, just to let everyone know that yes, we work very closely with them, and we actually are going to present a workshop, if you want to follow up, in now hands-on workshop in terms of the competencies and the toolkit. In the CUGH annual meeting, we're going to be presenting a workshop there, but also in our annual meeting, like a couple of weeks after that, in the ASPPH annual meeting, we will also going to have a workshop. So yes, we do work and we find synergies with all our colleagues, and that's why we are presenting this together here, because we work together with these groups and also with ASPR. There's a lot of work that it's on its way right now with ASPR and with CASIA in terms of using competency-based frameworks for the workforce. So happy to talk with any other group that you know that this could be useful, of course. Yeah.
Thank you, Dr. Magana. There's just one more question in the box, so if any of you have additional questions, comments, ideas, go ahead and submit them, because we will close early if there are no more questions after this next one. And the next question is, are there any experts available to help us if we need some advice or counsel on how to use these competencies. And I'll take that for starters, and then Dr. Magana, we don't have any particular plans for that area and no funding that I know of towards it. ASPPH would like to be helpful. So if there are any struggles that you are having with them, I'm not making any promises that we'll be able to answer, but we certainly would like to hear. Also, we'd like to hear of any successes that you've had, if you have any demonstration programs, examples, activities, assessments, rubrics, assignments, syllabi that you would like to share. That we are beefing up our online community site. We haven't used it so much the last few years. We're making refinements to our virtual discussion community that we very well could create, populate a group towards this end, where you would be able to discuss with each other how you're using these, what has helped you, if you'd like to share, that could be of value to you.
Right. No, we're just happy to support that idea, and anything that you need, we will, more than happy to share with you everything that we have in terms of the resources, and just to share the experiences, and just let you know that we just launched the Scholarship of Teaching and Learning among our members, and that's another group that's going to be looking at different resources or how to generate more resources for faculty that are really, wanted to improve their teaching. So happy to hear all the comments that you have, and we will direct those accordingly to the different sessions or groups that we have.
Thank you, Dr. Magana. I see a question just came in, and I don't quite understand it. It is, can we receive the title of the report for the weaknesses of global health programs? Was that something that Dr. Bentley had mentioned? Any presenter, if you'd like to respond, if you can answer that. Yes, okay, yes, Dr. Bentley, it is the report you mentioned. Is that available to the public, or just some gray literature within the Gilling School?
No, it's actually published in the literature, and under the name of Sharon Rudy, R-U-D-Y. But if you go to the Global Health Fellows Program, it should be available there. I also have it. If anyone would just like to email me, I'd be very happy to send it back. But I think there's a little bit more discussion about it and its impact and context in the document that's published.
Okay. Yes, I'm familiar with that. Thanks for the questioner for clarifying. And we could circulate it to all attendees to make your lives easier, and you all could take a look that way. So I'll make sure that happens.
Thanks, Liz.
Sure. Well, thanks to everyone for your questions. That's the last one in the box. So I would like to thank all of our presenters, Dean Curran, Dr. Magana, Dr. Abla, Dr. Bentley, and Dr. Shabanowska. Thank you so much for your time, your expertise, and your involvement with our effort. It really lends such a terrific asset to what we're trying to do here collaboratively with so many people, to have you as our leaders on this webinar. It's recorded and will be available on our website soon. There is the link. We do provide 1 hour of CPH continuing education credits for this webinar, so you can get your certificate for your participation here. And next, coming attractions, we have a number of webinars coming up, including a few in January. You could see it on the screen there. Innovative Approaches to Engaging the Public Sector on January 7th. And then the day after, the new Congress and Missions of Academic Public Health. Again, all free and with CPH continuing education credits. We also would like to highlight that our annual meeting, Dr. Magana did mention it, where we are going to have a skill building workshop that Dr. Abla and a colleague from the Columbia Mailman School are going to lead, and really having folks roll up your sleeves and apply these competencies to your own global health programming in association with our annual meeting. And that Skill Building Workshop will be on March 20th. The annual meeting has a very exciting program over the course of those 3 days. The first day of our annual meeting, as is our recent tradition, will highlight the undergraduate community who are now part of our membership in a special way through the network, and that's the Undergraduate Public Health and Global Health Education Summit on March 20th. Both events are here in Arlington, Virginia, right outside of Washington, D.C., in the same location where we held our annual meeting last year, if you were there. And that is all we have to say. We're wrapping up a few minutes early. I want to thank everyone, and the webinar is now adjourned.
Thank you, Liz.
Thank you very much.
Thank